Why does excess fat in the body cause so many different diseases? The problem occurs because as you accumulate more and more fat, your adipose tissue or your fat tissue becomes inflamed. Perhaps the main actor in this chronic inflammation is one of your body's own immune cells called the macrophage. The macrophages in adipose tissue are called adipose tissue macrophages, or ATMs for short. Hi, I'm Dr. Maria Conley, and today I'd like to talk about these adipose tissue macrophages, or ATMs, and how these immune cells secrete proteins into the bloodstream that cause chronic inflammation in the body that can eventually lead to cancer, Alzheimer's, dementia, and type 2 diabetes. Only a few decades ago, we thought that fat cells, or adipocytes is another name for them, were merely storage deposits for fat or triglycerides. However, we now know that adipocytes are actually endocrine organs, releasing more than 600 different types of proteins or adipokines into the bloodstream. These adipokines include hormones and cytokines, which regulate appetite and satiety, inflammation, blood pressure, insulin sensitivity, and energy expenditure, among other things. When a person becomes obese, their fat cells or adipocytes gradually enlarge and secrete more pro-inflammatory proteins such as TNF-alpha and interleukin-6, IL-6. As the lipid droplet in each adipocyte gets bigger and bigger, the cell expands until it outgrows its blood supply and becomes starved of oxygen. When this occurs, the enlarged fat cell dies. Certain scavenger cells in your immune system, called, again, macrophages, migrate through the bloodstream and enter the adipose tissue to get rid of these dead fat cells. These phagocytes, in Greek meaning eating cells, join the resident macrophages that are already present in adipose tissue. Together, these adipose tissue macrophages surround and gobble up the dying fat cells. These pro-inflammatory ATMs are the main source of inflammatory cytokines such as TNF-alpha and interleukin-6. These damaging proteins cause chronic inflammation in the body and can actually promote tumor formation, development of diabetes, and can worsen the symptoms of Alzheimer's disease. TNF-alpha also downregulates adiponectin, which is an adipokine that promotes insulin sensitivity and burning of fat. Adipose tissue macrophages make up 5% of all the cells in adipose tissue in people of normal weight. But in obese individuals, this percentage jumps to 50% of all cells in adipose tissue. You need a healthy adipose tissue to serve as a storage site for fat, which can be used as an energy source. The problem develops when an individual becomes obese, causing their fat cells to gradually balloon out as more and more fat or triglyceride is deposited inside each individual cell. These enlarging adipocytes outgrow their blood supply, become starved of oxygen, and begin to die off. The macrophages of your immune system sense the presence of these dead cells, and they travel to that site to ingest and destroy the dying fat cells. The adipose tissue macrophages are successful in getting rid of the dead fat cells, but unfortunately, they also produce chronic inflammation throughout the body, contributing to insulin resistance, certain cancers, and Alzheimer's dementia. Thank you for listening. I hope that this was helpful.